Welcome to the ADA discussion on strategies to prevent burnout and improve work-life balance. My name is Sasha Sicard, and I am the Associate Director of Education and Member Engagement here at ADAA. We are delighted to have Dr. Jenny Yip and Ashley Bramhall here with us today to discuss this very important conversation. Dr. Yip is a clinical psychologist, author, speaker, media contributor, and nationally recognized OCD, anxiety, and parenting expert. She is board certified in behavioral and cognitive psychology and has treated severe OCD and anxiety disorders for over 2 decades. She founded the Renewed Freedom Center in Los Angeles to provide the most advanced treatment for OCD and anxiety disorders, and also established the Little Thinkers Center to help children with academic challenges build resiliency. Dr. Yip co-hosts the Stress Life podcast and is author of Productive Successful You: End Procrastination by Making Anxiety Work for You Rather Than Against You. Ms. Ashley Bramhall is the program director at the Renewed Freedom Center. She specializes in the treatment of pediatric anxiety, OCD, and related disorders using evidence-based CBT, exposure and response prevention, and mindfulness techniques. Thank you both for joining us today. I would like to start off with a bit of a general question. Can you define what burnout means?
Well, I think there are many different definitions of burnout depending on what context you're thinking of. For myself, as a mother of 2 5-year-old twins and also a professional running the Renewed Freedom Center, and all the different professional hats that I wear, burnout isn't just about the work context. It is burnout in any area of my life, whether it's as a mother or as a professional. Now, I do know that the ICD-10 or ICD-11 describes burnout as just in your work environment, where you would be completely taxed of energy, you would be feeling irritable, perhaps pessimistic, you wouldn't be effective and productive at your work. So that's the ICD's definition. Though I think most of us, especially in the last 2 years, have experienced burnout, no matter what context we're describing it as.
Yeah. And I think it's important to add to that like Dr. Yip said, it's not just in the work arena, but also that everybody experiences burnout differently. So what one person's burnout looks like is going to be different than another person's burnout, and to be able to be open and compassionate and hear everybody out and not just be like, well, I'm not burned out and I'm doing the same amount of work, or my life is crazy and I'm not burned out. How is yours? You're doing nothing compared to me. So I think that's also an important thing to take a note when we talk about burnout overall.
Yeah, so burnout has obviously been a key word that we've been seeing in the news. Is this kind of a new phenomenon, or has this been around and it's just kind of now coming to the public attention?
You know, my husband and I talk about this all the time, and I think the reality is that burnout has existed. However, in the past, when we were burnt out, I remember being a student, being a grad student, then being a trainee, you don't get to complain about it. I think in today's time, perhaps highlighted by the pandemic in the last 2 years, burnout has been much more apparent, probably because we were all stuck at home, and then trying to find that balance in the home space, which was also made for the workspace at that point in time, became extremely challenging. For myself, especially with parents with children, having to deal with your children being stuck at home and then trying to homeschool them, and then trying to work with children at home, that was very apparent for everyone, and that probably highlighted the reality of burnout.
Right.
And I think it's being taken more seriously, like actually trying to do something about it and prevent it now, where previously it was always there, but it was just like, yeah, I'm burned out, and
Right.
it just kind of sat there.
There was no continuing conversation between that. So how do you start a conversation with a loved one, or how do you know to go seek help if you are feeling burned out?
I think anytime that you feel like you need me time, that's when you need to have that conversation. Anytime you feel like you're not being effective at whatever the task is, if you feel like your tolerance has been compromised by the demands of daily life, that's a conversation to be had, whether it's with your family members or even within the workspace, with your colleagues, with your bosses, whoever else is involved in your day-to-day life. And I don't think it's difficult, especially given how much attention is paid on that in the news today, right? I don't think it's difficult to have that conversation today.
And I think the running theme with everything Dr. Yip just said is this piece of awareness. Because if we're not aware that we're burned out, how are we going to have the conversation? If our loved ones aren't aware of what burnout looks like, how are we going to have that conversation? So awareness is really, really big to be able to identify and have those conversations and to ultimately make a change.
That's great. So how do we improve our work-life balance, and what steps do we start to take to make sure that we're not burnt out?
That is a multi-million-dollar question, right? I think number one, striving for a 50-50 balance between work and life is not realistic. I think even the term work-life balance sets us up for failure and disappointment. And then that in itself turns into stress in it, because we feel like we're not able to maintain work-life balance. What is important to realize is that if you are aware of what your obligations are throughout the year, throughout the month, throughout the weeks, throughout the day, you can make space for balance in certain times of the day or the year or the month. But trying to strive for a 50-50 balance 24/7 isn't realistic, and it's just a setup for failure.
Yeah, and because isn't work a part of life? So what is this balance piece of things? So to me, it comes more down to what are your values? So if you're strong in your values and you're trying to live your values, then some level of this perfect ideal of balance maybe will be fabricated because we're prioritizing the things that we value, whether that is in the workspace or home or just social life or whatever else. So I agree that this idea of balance is nonsense, and we need to throw it out because that's what everybody's striving for, which is why everybody feels like they're failing at that all the time. So if we can eliminate that word.
Yeah, so I think the word that we would like the public to go for is work-life awareness. The more you're aware, not just of what your priorities are, right? So Ashley spoke about finding your values, clarifying your values, what is priority, what is secondary, and then being able to put firm boundaries around that. And if we think about boundaries, there are so many different kinds of boundaries. There are emotional boundaries, there are mental boundaries. You can put boundaries between yourself and your family, yourself and your work, or even within yourself and your own thoughts. I think if we are more clear on where our priorities are, then we can start implementing those boundaries. And when I think about boundaries, I think about the Venn diagram. So for those people who are familiar with the Venn diagram, they're just intersecting loops. And you plug in whatever your values are, whatever's important to you. Hey, if work is important to you, if coming to the ADAA conference is important to you, then I would be here as I am here. And I'm missing out on my children's soccer practice and basketball games and piano recitals, right, to be here. So I think clarifying what is more important to you, not that my children are not important to me, of course they are, right? However, I get to see them playing piano and basketball almost every single week. I don't get to come to ADAA every single week, right? This is a once a year. And in fact, it's actually been over 2 years since we've been here together. So this was very important to me to attend the conference, and therefore I made a firm, decision to take the time to be here and let my kids know that mommy's gonna be gone, and I'll see you guys every day over Skype or FaceTime, and I will be back.
Yeah.
Just to add to so Dr. Yip visualizes as a Venn diagram, and I kind of visualize it more as like the scale that we see associated with law and lawyers. And when one thing starts to kind of skew to one side and you notice that, then you start putting effort into, okay, let me try to get it back to balance. But it's never going to be perfectly balanced. It's going to continue to go up and down on the sides. And it's just noticing when they're getting farther apart and working to bring them back together, essentially.
So whether our scales or our Venn diagrams are a little unbalanced, what are some tips that we can give to our audience on how they can realistically manage and be more aware of their priorities in their lives?
Well, first of all, we have to realize that we only have 168 hours in a week. That is not a lot of time. If we take into consideration how much time we have to devote to sleep, and you have to prioritize sleep, because without sleep, you're not going to be able to replenish your energy, and that will quickly lead to burnout. You have to take into consideration all of the demands just on a day-to-day basis. And if we realize that there's only 168 hours in a week, and we subtract all of the demands that we are responsible for, how many hours are really left in a given week? And then we divide that into 7 days, you really don't have much time left. So I think number one is being aware of that, right? So again, we're talking about increasing your awareness of your priorities, of your schedule. Also, we have to remember self-care is important. And the analogy that I usually have my patients think about when I'm working with mothers and other professionals is it's kind of like when you're on the plane and when that oxygen mask comes on or drops down, they tell you to put it on yourself first, not because you're selfish, because if you are no good and you collapse because you have fainted from a lack of oxygen, you won't be able to help anybody else. And self-care is very much that exact same way. You have to take care of yourself before you're any good to take care of somebody else, including your children. So whatever that time is left out of that 168 hours, you better find some time to replenish your energy and do something pleasant for yourself.
And I like to take a little more I don't know if practical is the right word, but when we talk about self-care and all that, it's usually kind of frou-frou, like, oh, take a walk, get some sun, go to the spa, things like that. And while all that is important and it is helpful and it is acts of self-care, I think we forget about the more practical stuff that aren't as fun to do. Like, again, that piece of awareness we keep bringing up, but I'm big on knowing your red flags. So knowing those signs that you are starting to decline. So like for me, it's if I start procrastinating more, even on the smallest tasks, or just start avoiding things more. I know those are two big signs. Or I start doing more work at home. So I'm very aware of my signs. So when those things happen, I'm like, no, I don't want to go down that route. So let me try to get it back on track here. And little things like in your email, put a disclaimer, like, don't expect me to respond within 48 hours. Or I've started to do, even on the weekends, I will put in an away email just so they know not to expect necessarily a response. They might get it, but not to necessarily expect the response. And I think the idea of boundaries is immensely huge. But the problem with boundaries is that it's not easy, and it comes with a lot of discomfort. So it's something that everybody needs to be able to do, but not a lot of people have the skills to be able to do it. So one, I would say, educate yourself or other people on how to set boundaries and how to tolerate the discomfort from setting boundaries, or set yourself up to do your own little exposures where you start setting boundaries with people and then tolerating the discomfort. And one way that I was able to personally do that for myself is I asked myself kind of a question, would I be feeling this way if, and fill in the blank. So if a patient's trying to get in last minute, for example, and I technically have an opening on my schedule, but it would make my day a really difficult day, I'm going to feel bad saying no because I want to get them in. But I also have to care for myself and not burn myself out. So I have to still set that boundary. And then I ask myself, well, if that time wasn't available, would I still be feeling that way? And then the answer is no, and I'm able to move on a little bit more. So that's one of my favorites. I do that with everybody in the office too. Would you be feeling that way if you didn't have that time or this didn't happen? To try to help them set their own boundaries as well.
And, I just to piggyback on what Ashley was saying, self-care doesn't necessarily have to be these big, extravagant experiences. We're not talking about spending 2 hours at the spa, even though that would be terrific. We're talking about taking 5 minutes out of your morning for coffee without interruption. Taking just a few minutes out of your busy schedule to decompress and to just be. You don't necessarily even have to do anything. You can just shut your eyes. That is self-care. I, joke about this, but there have been times where as soon as I get home from a very long day at work and my kids are like climbing on me, I would give each one a hug. I'd pour myself a glass of wine, and I'd hide in my own closet. And my closet would have a do not disturb sign on it, just like, in the hotel rooms. And my kids know that when that sign is up, it means that mommy just needs me time. So it's just little things,
Yeah. I'd like to just wrap it up with kind of one final question. For those who are suffering and kind of don't see a light at the end of the tunnel, it does sound like if you take some time to do self-care, that things will feel better and that they will stop being burnt out and maybe stop being so stressed.
I think it takes practice. We are not accustomed to saying no. And we have to start practicing saying no, thank you. Because if we don't, no one else will do it for us. So if we are really prioritizing self-care, one of the main tasks would be to practice saying no, thank you. Now, that doesn't mean that you don't care. It doesn't mean that you're not giving yourself or giving your time. It just means this moment for this task, I just don't have the bandwidth to do it anymore. So you say no, thank you. And the more you're able to practice no, thank you, the more you will be comfortable with it, and then the easier it'll get over time. But don't expect a quick fix. That's never realistic.
That's exactly what I was going to say, is it's super easy to get burned out, but recovery from burnout is not as quick as how quickly you can get burned out. So to have compassion for yourself and take one foot in front of the other. You don't have to do it at all at the same time. and throw yourself back in there, and just know it is going to take time to recover from it, for sure.
Perfect. I'm so happy to have you guys here today. I think our listeners will have a lot of great advice and be able to know that they are not alone in their experiences, and know to take a little bit of time in their day to perhaps just close their eyes, which maybe I'll do in just a little bit.
Yes, right now, everyone just shut your eyes for even 10 seconds. That's self-care. Thank you so much for having us, Sasha.
Thank you so
Thank
much.
you.
Have a great day.